meeting is now being recorded.
Good morning, everyone. This is Lenita Hartman with Early Intervention Colorado. Welcome to our technical assistance call. And I just want to thank everyone for your participation in the statewide meeting. And thank you for those that completed the survey so that we can collect feedback to make next year even better, hopefully. So today we're going to talk about some updates and give you a little sneak preview about our upcoming website, and we're going to go over some details around the trust, year-end billing, and TCM, and talk about the upcoming monthly TA calls for the year, and give you some updates on training, the family outcomes, and there will be an opportunity for you to ask questions at the end.
All right. So, great news, everyone. The EI website is getting a makeover. So, we are currently in the process of creating a new image for the EI website and what that looks like to everyone, you, providers, families who are using it. On this slide, you'll see a snapshot of what that new website is going to look like. So just a reminder, please know that this is not completed yet, so what you're seeing on your screen, we know there's things that need to be changed or fixed, and the picture's not right, they're centered, but we just wanted to give you a kind of snapshot of what that's going to be looking like, because it will be going live as of July 1st. So that will be when you will see how the website has changed for everybody. The website address will stay the same, so you do not have to learn a new website address, change anything on your printed material, or tell anybody anything different. So the next couple of weeks, we're going to be doing testing on the site, so hopefully that we will get all of those bugs and the things worked out before the public sees it. But just let us know if there are some things that are missing as it goes live, if you guys are exploring and you're seeing things that that you think should be on there, or that are missing, or not linking correctly, and we will work diligently to get all of those fixed. So, yeah, that's what our new website is going to look like.
All guests have been muted.
Hi, everybody. This is Wayla. So as we make these changes, especially with the bridge training, there are some links in the bridge training that have been linked directly to our old website, and so it's going to take us a little while to get those fixed. So just know that some of the links in the bridge training, especially things that are linked to our website, may not work. But the pillars and key principles, those will be updated in the bridge training workbook. So you can feel confident that new service coordinators can start going through that bridge training. And if there are issues, please have them contact either Monica or myself, and we can work on that. Temporarily, there's a for families Spanish section that's not going to be available, but we have a framework for a Spanish function on the website, so we're going to be working on getting that information up and correct on the Spanish portion of the website. Also, because of this changes to the website, we're not going to be updating immediately the forms like we usually do, where we say revised or reviewed in July 1st, 2017. So but we will have the most current forms on the website, which were reviewed July 1st, 2016. So please continue to use those. You don't need to change forms or anything currently, and we'll let you know when the revised forms are available on the EI website. We don't anticipate that any of the forms are going to be changing, so there's not going to be a big problem with that.
So we have been talking over the past few months, maybe even the last year, about the project we're working on to bring the Early Intervention Services Trust accounting system into the Unicorn. And we are full-fledged in that project, and it should be rolling out, well, we're on track to roll out by July 1, but we'll have a definitive answer to whether it will by tomorrow. I just want to mention this because we will be sending out some information on how incorporating the Southern Accounting the Southern Accounting Office into the Unicorn will impact the way CCBs enter data. You won't see a whole lot of changes related to this, but we will be sending out some information and communication brief and then answering any questions that people might have regarding this change. We're pretty excited about it because it should really simplify trust billing and give a lot more information on what's being paid and just really simplify that whole process. We also wanted to talk about the year-end billing. We, as you know, have had some issues with Medicaid paying early intervention services. So we are getting a lot of utilizations entered into the data system that some CCBs anticipate might be reimbursed by Medicaid once all the issues have been resolved. And so we are going to be adding some functionality into the data system to indicate on those utilizations whether they are utilizations that you would expect to get reimbursed for, so that we can assist you in tracking those payments and help us understand our fiscal situation as we wrap up this year. The last thing I want to talk about is a few months ago we had some conversation on one of our monthly TA calls around documentation needed to bill targeted case management. We have clarified that, and we have a communication brief in clearance to address those. We're running it by healthcare policy and financing to make sure that we're relaying accurate information about eligibility of children for targeted case management, and then we'll be sending that out. So I hope to have that out early next week. So look for that, and I think you'll be happy with it because we have made some adjustments to the health insurance authorization form to simplify the beginning of billing for children with an established condition. And so that is what the communication brief is about, is documentation needed to begin billing targeted case management for children who have an established condition. So we don't have any immediate changes planned for the EI Colorado state plan or the FMAP. We anticipate that we may have some changes to the state plan, which are also our state rules. But any changes that we make will not impact any CCB practices for the fiscal year 2017-18. Most of those changes that we'll be making are really focused around procedural safeguards and then some technical cleanup of rules. So everything is status quo. this year, so, or for 17 and 18. So go forth and implement the state plan.
All right. The next slide, or what you're looking at, is the proposed schedule for the upcoming monthly TA calls with topics. As you can see, the topic for June is all about changes and new fiscal year updates. Just keep in mind that the dates and topics may change as we go through the year as things come up, but we wanted to share the suggested information with you to give you an idea of what we would be discussing during each month's TA call. Also, just to let you know that Bridget Burnett is available for our August TA call to present information on working with families, as she was unable to make our statewide meeting. So that's exciting that she's going to be able to present that information to everyone as a group. And just note that the time for her presentation is 90 minutes instead of the regularly scheduled hour. So that information will also be sent out to everybody after this TA call so that you can reference this for the future. Also, the statewide meeting date and location for next year is still to be determined. So as soon as that information is updated, we will let you know that also.
So we're really excited about the EI fundamentals training. The filming is currently underway. We do want you to continue to use the bridge training for your new service coordinators. We'll be posting any updates to the bridge training on the EI Colorado website. So whether it's the current website or the new website starting July 1st, be sure you're accessing the workbook from there for your new service coordinators. We're also holding office hours regularly. That's a part of the workbook and needs to be signed off by supervisors when new service coordinators are a part of that, and there are instructions for that in the workbook as well. And we really want to thank all of those that have volunteered to help us with our filming and recruiting of parents, providers, people working with families. It's been really exciting to be a part of seeing the filming come together, and I think you're really going to be pleased with our new Service Coordinator EI Fundamentals training, which will be rolling out in the fall or early winter.
Hey everyone, this is Ashley Ness here. I am filling in for Ashley Burney to give you updates on the Family Outcome Survey. So the survey is currently open, and it will stay open until the end of June. We do have it available to stay open longer depending on how many responses we have, so please encourage all families to complete that survey. The survey was mailed out to families, and you can also fill it out online, and that is the link right there. You can also go to our website if you would like to print out some surveys and bring with you to the meetings, and then you can just mail it back to us, and we will make sure everything gets entered. We really appreciate all your help with this, and the family's opinion matters, so let's get out there and collect those surveys. So, some upcoming dates and announcements. There is a unicorn road trip going on, so yay! I'm taking the unicorn on tour of the state. Super exciting. So I'm going out next week to go ahead and visit 4 different CCBs. I will be reaching out to all CCBs to see if there's any sort of training or technical assistance that you might want, whether it be face-to-face, over the phone, webinar, totally up to you guys. We'll look out for that. Also, the year-end data, so fiscal year 16-17, is due 5th. So that's all data for fiscal year 16-17. The reports are located in the unicorn in the indicators federal fiscal year 16-17 folder. So August 5th, keep that date in mind. We wanted to let everybody know that the Alliance Summit, which is taking place this month, June 21st through the 23rd, some of you attend the Alliance Summit every year, and just wanted to let you know that we will, Ashley Fernie and I, this is Christy, are going to be up there doing a presentation on Friday, the 23rd. If you're interested in attending, it is not EI specific. We are going to be doing a presentation around using data to measure quality improvement activities, and so we've created, or I should say Ashley Fernie is creating a really fun, interactive presentation on how you can use data to, how you can select improvement activities, and then how you can collect data to see whether those improvement activities are helping. So just wanted to give you a heads up in case we've gotten a few questions about what our session is going to be like, and will it be something similar to an ETA calls, and it will not. It is going to be a much broader topic than early intervention. So you guys get any questions about that? Just wanted to give you the information.
Great. Lanita here, just an update on Go Forward activities. Strive will be hosting their two-day visit June 21st and 22nd. And Eastern's Universal Training is coming up on June 29th. And so if anyone wants to go on a road trip, if they have providers that haven't received the training, they should contact Laura if their providers want to participate in Eastern's training. And on June 15th, we have the Community of Practice call for both Cohort 2 and Cohort 3, so be sure to join us. And then finally, just a reminder, we put out a request for help for outreach to families that have been referred to early intervention through CAFTA, and we know that that is a quick turnaround to try to reach the families, complete the surveys, and get that information to us by June 16th. So we really appreciate your assistance with that, and the turnaround is due to a tight turnaround on our end at a higher level. So we thank you for doing that, and if you have any questions, be sure to reach out to me so I can help you with that. And then we would like to unmute your phones and open up for questions about today's call.
All guests have been unmuted.
Any questions or clarifications?
This is Stephanie from Imagine, and I got on the call about 4 minutes late, but I understand that the new service coordinators have to do the bridge. Are service coordinators going to be accessing the bridge for any reason? I guess I'm a little confused about that.
So the bridge training is what we put in place to bridge between the time that we did our in-person trainings and the time that we have our online training available. And so they're accessing the bridge training. It's basically a workbook that they work through, and it refers them to several different online trainings. And so new service coordinators need to take that bridge training. And we know that with the changeover of our website, which is happening July 1st, some of the links or documents may not work because of that, but mostly the bridge training will be fine, and service coordinators can still go through that. So service coordinators that have already been through that, They can certainly reference their workbook that they had previously. That's no problem, but there's not going to be a requirement for that. Did that answer your question, Stephanie?
It does. I know there's a new state program called the Bridge that our coworkers that are case managers use, so I was getting confused. So thank you for clarifying.
Right. So it is something totally separate. We heard that when we were in Horizons. They were talking about something else called the Bridge, and so it is a little bit confusing. But this, what we're referring to is our service coordinators, basically core competency, the state required training, we're calling it a Bridge training. Thank you.
Hi, this is Pat over in Durango, and I thought I heard you say that there weren't going to be any new forms, but then it seems like there was going to be a change on the health insurance authorization form. Am I understanding that right?
Good catch.
Tricky.
I know, I was pretty proud of myself.
We'll send you a gnome. You are correct. We did say that there were no changes to forms, and then there's going to be a change to health authorization form, but it's nothing major. And like I said, we are waiting for it to make its way through clearance, and as soon as it gets through clearance, we will send out a communication brief with the new form, and we will have that new form posted on the website.
Perfect.
And I think what we were trying to say is you guys with the new website are going to get on and see the old reviewed dates on the forms, and we just didn't want you to be alarmed by that, and just know that any form that's on the new website will be the current form to use.
Okay, perfect. Thank you.
This is Melissa with TRE. On the Family Outcomes Survey, if we are printing these off and taking them to families, where do we get the survey identification number from?
The consumer ID, so the consumer ID is actually on the contact.
Okay.
And it's a 6-digit number. If you need help locating it, you can either contact myself, this is Ashley, or you can contact Ashley Burney. But it's a 6-digit number right on the client's contact.
Okay, thank you.
Yeah, and you can also, so if you're emailing Ashley for any questions regarding the Family Outcome Survey, I'm getting them as well, so there's no need to send duplicate survey or email.
Okay, thank you.
Yep.
Any other pressing questions before we wrap up for today?
All right. Well, thank you, everybody, for joining us today, and we will see everybody, we'll hear everybody, our next TA call.
Thank you.
Thank you.